Diabetes. Diabetes is a condition that causes a person's blood sugar level to become too high or too low. There are two main types of diabetes. Type 1 diabetes, a lifelong condition where the body's immune system attacks and destroys the cells that produce insulin. And type 2 diabetes, where the body does not produce enough insulin or the body's cells do not react to insulin properly. Type 2 diabetes is far more common than type 1. In the UK, over 90% of all adults with diabetes have type 2. Pathophysiology of diabetes. Type 1 diabetes results from the autoimmune destruction of beta cells of the endocrine pancreas. Pathogenesis of type 1 diabetes is different from that of type 2 diabetes, where both insulin resistance and reduced secretion of insulin by the beta cells play a synergistic role. Whereas in type 2 diabetes, the chemical messenger insulin is produced to assist with the entry of glucose into cells. When glucose levels rise after a meal, insulin is released into the bloodstream and starts to trigger the process of removing glucose from the blood to enter into the cells. Unfortunately, the cells become resistant to insulin where it ignores its message to allow glucose to enter the cell. This is known as insulin resistance. Additionally, the pancreas also struggles to produce enough insulin to trigger these cells to take in glucose. Gestational diabetes is a complication in pregnancy affecting 5% of and develops when the level of compensatory insulin secretion is insufficient to meet the level of insulin resistance. Subscribe to the channel for more.